Welcome to Beyond Bandaids, the NASN podcast where we celebrate the vital role of school nurses in shaping healthier schools and brighter futures for our students. We will come together monthly to share insights, stories, and strategies that demonstrate the critical role school nurses play in student success. From daily care to big picture advocacy, NASN supports school nurses and empowers them to create resilient communities. When we work as one, we are stronger together. This month, we are sharing a special replay of a powerful conversation I had with North Carolina Senator Gale Adcock at our annual conference. Senator Adcock's story is a remarkable one. She began her career as a school nurse and went on to become the first nurse elected to the North Carolina Senate. Our conversation is a reminder of just how influential nurses can be, not only in the health of students, but also in shaping the policies that impact families, schools, and communities. We chose to bring you this episode right now because the political climate is challenging, and school nurses' voices are needed now more than ever. Decisions about health, education, and equity are being made every day, often without the expertise of nurses at the table. By listening to Senator Adcock's journey, I hope you see how your knowledge, your credibility, and your advocacy can make a difference, whether in your school, your community, or even in elected office. So, with that, let's listen back to my conversation with Senator Gale Adcock.
This is it. We made it. I know, I agree. I am especially honored to introduce our final speaker of the conference for a conversation that I know will inspire, challenge, and empower each of us in this room. As school nurses, you are the eyes and ears of public health in your communities. You are trusted professionals, frontline responders, educators, and fierce protectors of student well-being. And yet, too often, your voices are left out of the rooms where decisions are being made. That's why today's session is so important, and why I want you to consider your own potential to influence policy, even if you don't run for office, throughout the conversation. I'm thrilled to be joined by someone who knows firsthand what it means to take the knowledge and credibility of nursing and bring it into the policy arena. Senator Gale Adcock is a former school nurse, a fierce advocate, and a sitting member of the North Carolina General Assembly. Her path is a story of boldness, purpose, and possibility. This bio, y'all, is going to take me a hot minute to get through because there's a lot. Gail has a nursing diploma from Virginia Baptist Hospital, a bachelor's degree in nursing from ECU, and a Master of Science in Nursing from UNC Chapel Hill. Gail got her start in nursing as a critical care nurse, but she told me as quickly as possible she transitioned to school nursing, and has been a nurse practitioner since 1987 and was Chief Health Officer at SAS Institute for more than 26 years before retiring in October of 2020. Gail has been president of the North Carolina Nurses Association, chair of the North Carolina Center for Nursing, and a member of the North Carolina Board of Nursing. Welcome, Gail. We are so excited to have you here. I have a number of questions. We're just going to have a little chat. So, Gail, you've described your background as covering the nursing waterfront. Can you share what drew you to nursing and what led you to school nursing specifically?
Well, let me start by saying it's wonderful to be with you folks. I've been trying to get here for the last 28 hours. So it's thrilling to be here. Thank you for inviting me for this conversation. This is a topic for which I have a great deal of passion, and I love to talk to nurses about it. I particularly want to give a shout out to my school nurses from Guam who welcomed me so warmly when I walked into the room. And to your wonderful school nurse, Adolia, who complimented me on my red jacket and made me feel like $1 million. So I'm all set for nothing's better than a girlfriend telling you look good, So, well, Terri, here's the interesting thing, Terri. So I'm an early talker. You're going to find out how much I like to talk. And I started talking early, and I said from my earliest age that I wanted to be a nurse. Now, I didn't know what a nurse was, folks. And most of us, when we get right out of nursing school, we actually don't know everything a nurse is. We think we do. When we're 21, 22, we think we know everything, right? So I just never considered doing anything else. And lucky for me, when I was thinking about being a nurse, I was thinking like many of y'all might have when you first became nurses, you take care of one patient at a time, right? I was a critical care nurse, bedside, and then I worked in a hospital and a nursing home. And when I went back to school immediately after my diploma program within that first year, I got my BSN, and I fell in love with public health because we don't have that, we didn't have public health curriculum in a diploma program. So when I moved to Raleigh, 2 hours away, I got a job as a public health nurse. And because we had a generalized public health nursing program, I got to do home care, school nursing, run little clinics in this tiny little town where all the people would come because they couldn't get to Raleigh, 60 minutes away. And I fell into school nursing, and I loved it. It was one of the most challenging things I've done. It was also something I went to work every day going, I can't wait to get there. And of course, I hate to age myself this way, but I was a school nurse 40 years ago. And school nursing, I know, is even more challenging and more complicated in terms of how schools are run, the sick children who come to school who have chronic illnesses and have mental health and substance abuse issues and all of those things. Your job is more challenging than the job I had then, and that job was plenty challenging. So I gave up public health nursing to go back to school to become a nurse practitioner. I didn't want to. I didn't want to give up being a school nurse. I didn't want to give up being a home care nurse and running those little clinics. But when I went to my master's program in the dark ages, you had to give up your full-time job to go. Now, if any university tried to do that to you today, you would laugh them out of town, wouldn't you? You would not put up with that. But, that was then and this is now. So those days being a school nurse have helped me so much in every other job I've ever had, and particularly in my position first in the North Carolina House and now in the North Carolina Senate, because when we talk about school health and we talk about the staff that schools need, both school nurses, school counselors, school psychologists, I'm coming from a place of knowing, from a place of lived experience. No one else in the 170 members of our General Assembly can do that.
Yeah. Absolutely. What was it like transitioning from direct care to public office? And was there a moment when you realized policy and policy change was your calling?
So here's one of my favorite questions, because I didn't give up direct care to go into elected office. I started my elected career 17 years ago 18 years ago actually this year. And I still had my full-time, more than 40-hour-a-week job as the chief health officer at SAS, which is a global software company. I ran the on-site family practice where we provided free primary care to all of our employees and their family members, so 14,000 people from babies born yesterday to people in their 80s. And we did everything for them. We did their acute care, their chronic illness management, we did their PT and psych and everything you can think of for free. And so when I ran for office the first time, which was in 2007, I had been thinking about it for 10 years. I don't know about you, but here's a statistic I know. Most women have to be asked 7 times before they run for office. And I was probably asked at least 7 times. And so over that 10-year period, I went from thinking that people were joking when they said to me, Gail, you should run for office. These were nurse friends, nurse colleagues at meetings we would be at. You know how you go up to the mic and you have to, talk. And I went from thinking they weren't talking about me, to thinking that perhaps I could do it, to believing I could. And one of the things that made a difference was being a member of my state nurses association. So when you go back home to whatever state you're from or country you're from, in the case of Guam, or territory you're from in the case of Guam, if you're not a member of your professional organization, I'm going to tell you that is job one. Now, I understand that it's really important to be a member of the National School Nurses Association, but I'm guessing, and if I'm wrong, you can tell me, that NASN doesn't have a state affiliate in every state that is doing policy work at the General Assembly, that hires a lobbyist to watch your back and to make sure that that laws that are proposed and passed protect all of nursing, not just school nursing, although it includes school nursing. And so you have to be able to cover the waterfront in that. You have to take care of your specialty, but you have to think of all of nursing as well. So I would say that to you. So when I was a very young nurse, 26, I joined my state Nurses Association, North Carolina Nurses Association, where I had moved from Virginia. And that set everything in motion, and I didn't even know it. It was like a target-rich environment for leadership development, mentors, employment opportunities. Everything that I have learned to do started there. So that I can't say that strongly enough. And so when all these nurse friends started telling me I should run for office, I did what every nurse does. When you want to do something new, don't you go back to school? You either go get another degree, you get a certification, you take a special course, right? So I went to campaign school, and I figured this, and this was 2006, and it's going to be 20 years next year. I can't believe it. I said I'll either love it or I'll hate it, and I didn't hate it. And I found out that because I was a nurse, in the 22 fellows in my cohort, I was the only healthcare person. I was the only nurse. And what I found out was I had a leg up on every other person in that group because I was a nurse. I knew how to talk to people. I was not afraid of a crowd. I knew how to ask smart questions, deep, probing, critical thinking inspired questions. I knew how to get data. I knew how to reach a decision. I knew how to explain myself to folks, because that's what nurses do every day. And I know you're going to ask me about my skill set later and how nurses do all this. And so when I decided to run I was going to run for the legislature. And here's something you have to know. When you're ready doesn't mean the universe is ready. I felt like I'd be ready in a year or two to run for the legislature, but there was no way for me to do it. Why? Because my House member was a great guy who I had worked in both of his campaigns. I wasn't running against an incumbent. I would have been squashed like a bug. And I would have really ruined my reputation within my party to run against a guy who was doing such a good job. My senator was a guy who was of the other party that I supported. He was great. I'd voted for him several times. He was not going to be beaten. So I thought, okay, I'll keep doing what I'm doing. I'll work in precinct politics, going door to door, working in other people's campaigns, making sure that people knew who I was and everything. But the next year, I was approached to run for local office. There was an empty seat on my town council. And here I was, fresh off of campaign school. What did I say? No, thank you. Why? Because I got cold feet. I was ready. I was prepared, let's say, on paper. But when faced with the possibility of actually doing it, I choked. And it took 10 people to lock me in a room one night against my will under false pretenses to convince me to file the next day, because here's what they said. I got there thinking we were putting together the short list of people who were going to run for this seat, and I came in late. Never do that, don't come in late. And I came in late and I said, so, who's on the short list? They sit down, you are the short list. And an hour later, they let me go. When I said yes, I would run. I went home, I said to my husband, I said, Kev, I gotta put up or shut up. I'm gonna file, tomorrow's the deadline. I said, are you surprised? He said, no, I wondered when you were finally gonna get off the stump and do this. So that's what led me to local government. And guess what? Just like school nursing that I didn't plan on but turned out to be wonderful, local government was something I'd never considered, and I loved it. And I was good at it because I'm a nurse. Yeah. I could walk into a room of, we have several, what they call continuing care retirement communities, and I would walk into a room of 100 folks who had wheelchairs and walkers and canes, and who were sitting up front because they couldn't hear too well. And I would walk in there with 3 or 4 other candidates, and they'd get behind the lectern and they'd grip it like grim death, scared to death. I would walk into the middle of the group, kneel beside somebody and say, what's your name? And people said to me, how do you know to do this? I said, I'm a nurse, this is what we do. We get personal with people, don't we? We try to get to know them really fast, and we're good at it. The other thing I said, people said, how can you get to know people so quickly? I said, hey, look, I'm a family nurse practitioner, and I was in family practice. I said, I got 15 minutes to get you to take off your clothes and talk about your sex life. I can talk to anybody about anything, okay? Politics is nothing. And I always say, nurses do harder things before 10 o'clock in the morning than anybody else does, especially politicians, in a week. We know challenging work. We are the most courageous people I know. We run towards the trouble, right? We're not backing up and going away. So that, so for me, the great news was I didn't give up my day job. And I want to say to you, if you haven't considered running for office, and one of the reasons you think you can't do it or it won't work in your life is because you can't go to Austin or whatever your state capital is because you live 3 or 4 hours away, or you have young children, or you're caretaking for parents, or whatever the issues are, consider running for local government. Consider running for your town council or whatever it's called in your town, city council or whatever. Consider running for county commissioner. Consider running for the school board, because here's what I found out, that there is health in all policies. That when the town councils are talking about how, if they're a decent-sized town, and when I represented had a seat on my town council, we had 140,000 people. I represented 35,000 of them. It's 186,000 people in that town now, where I live. But if your town's of any size, your town might be making the kinds of decisions that my town was making, which is how long cars are going to idle at the intersections, because they control the signaling system. Well, you see children every day, right, with asthma and other kinds of chronic illnesses, respiratory illnesses. It really matters how long those lights are red, how long people are sitting there if they're not in electric or hybrid cars, burning gas and polluting the air. You can have an impact on the rates of asthma and the kinds of exacerbations that children and adults in your community are having with their asthma. That's one example of what local governments do. You're making decisions in local government about how many parks are going to be. That vacant lot on the corner, is it going to be a park? Or is it going to be another drugstore, which I'm not saying you don't need pharmacies, right? But do you need one on every corner? Is it going to be another high-rise? Okay. If it's going to be high-density residential with 500 apartments, where's the green space for children to play? Where is the walkability so that adults can go out and walk around? Children can ride their bikes to school and get outside and play. Why is this important? School nurses know. This is how, if children can get outside and have activity, you might be able to bend the curve on obesity and everything that comes with that. And then our county commissions in North Carolina make decisions about mental health and things like that. So set your sights anywhere you want to take them, but don't minimize the opportunities in local government. And I'm going to give Terri my contact information, and I do this all the time. And maybe, my grandparents were farmers. They raised food. I can't grow anything. I don't have a green thumb, but what I do plant is ideas. And so if you think about anything that I've said today and it resonates with you, in 2 months or 2 years from now, you think, What was her name? I want to talk to her about running for office. You're going to have my contact information. Remind me where we met, and I will help you. I've helped nurses in California, Ohio, and many other states run for office. It's something we all have to help each other. So again, I stayed in practice for my 18 years until 4 years ago. I was still in practice every day. And yes, it was a challenge. It was a time management challenge because in the job I've had all during that time, I had a 68-member staff, and I was responsible for policy making at work, and I saw patients too. Half a day a week, which isn't everything, but it isn't nothing either. And finally, I got to the place where I felt like my body was in one place and my mind was in the other. Fortunately for me, I was at a time in my life where I could make the decision to choose a lane, and I had been in the direct clinical care lane for 45 years straight, but for having a couple of kids, and I rushed right back to work, let me tell you. So, that's 45 years straight, people. And so now, for the last 4 years, coming up on 5, my full-time nursing job is serving in the legislature, where I have 11 million people as my patients. And I take care of them.
I love that. This is going to be the easiest interview ever because I think you've already answered the next question. So this is going to be great. How do you stay connected, Gail, to your nursing identity? I really feel you touched on this, but I'd love if you could expand a little bit. In your role in the legislative arena, you just talked so poignantly about the fact that you're still nursing. But tell us a little bit about your nursing identity in that policy role that you serve.
Another question I love. Well, here's the thing. The only way to really make me mad is to say I was a nurse, not that I am a nurse. Because I still have my active nursing license, and I still have my active APRN license, and I intend to go to the grave with them, okay? I worked too darn hard to get them. And I know for a fact I couldn't pass that national certification exam again, so I'm not taking that chance, right? And in my state, you have to have national certification to practice as an MP, as you should. So here's the thing, is I don't know about you, but this year, and I can't believe I'm gonna say this in front of all y'all, but this year I've been a nurse 50 years. June 1st was 50 years. Yeah, you keep doing the math, and you're going, wow, and she's sitting upright, and she didn't come up with a cane, she's got oxygen, what's up with this, Good genes, choose your parents' will. But I can't not think like a nurse. Aren't you standing in the grocery line and you see somebody in front of you and you hear them breathing hard and they're, you're thinking, oh, that BMI looks like it's probably, 40. And you're thinking, oh, insulin resistant. You can't stop yourself, right, from thinking like a nurse. So when I've just changed venues for my thinking like a nurse, seeing things like a nurse, and bringing nursing experience. So the way that I make sure everybody in the joint knows I'm a nurse, right? You got to be like under a rock not to know this. First of all, when I'm in any group, the first thing I say is, hi, I'm Gail Adcock. I'm a family nurse practitioner, and yes, I'm a state senator. Nursing is who I am, and politics is something I do. And that is the difference to me. So every problem that I look at, both in local government and in state government and all these gubernatorial, commissions and stuff I've served on, I come to it and I look at every issue through a nursing lens, and it goes like this. What is the actual problem? How many meetings have you sat in where people talk, and they're not even talking about the real problem? They haven't identified the problem. We're really good at that. We can identify maybe 5 problems, and we go, and here's the one that's got to be solved first, right? The one that's got to be tackled first. So I come at everything with what's the actual problem versus what people may be talking about. Sounds sexy, makes a good soundbite so walking it back to the real problem. Asking tough questions. And some of those questions are, do we actually need to do this? Does it take a law to do this? I'm always telling my constituents, who are saying, I want you to file a law that does blah, blah, blah. And I said, well, guess what? You don't want us trying to solve your problem unless we are the ones to really solve this problem. It'll take a lot of time, it'll take a lot of money, and you won't recognize the solution by the time it gets to you often. And this is from somebody in government, right? Because when people are trying to solve a problem for a context they don't have, and this is where you come in, we're going to talk about that in a minute, that's a problem. So I go, does this actually need to be solved through state legislation? Or is it something the private sector can do? Or is it something the faith community can do? Or is it a function of a different level of government? Is it your local government, your school board, your county commission, the federal government? I feel like a lot of times my office play is like the air traffic control at O'Hare, right? My job's to get your plane to the right place, not necessarily to solve every problem you bring to me because I don't own it. And then I ask, just like you do, who does this policy help? Who does it hurt, either intentionally or unintentionally? Because if you're going to pass a law, consider passing a law, that's going to help, half the state, and it's going to really, really hurt the other half, well, that's a tough place to be. And you need to figure out how to help people and not hurt people, or set people back, or cost more money than it's costing to do what you want, what you're already doing, and you don't know how to measure the return. And that's the other thing nurses are good at. We don't just solve problems and gather data and come up with a plan, talking nurse and process here, you all know it. But we say, how are we going to measure success? What does success look like? And I've been very surprised, and when I first got started in politics, and I remain surprised, that often a lot of policymakers lawmakers who are not nurses, of course, are sitting around the table, and they've got in our state anyway, we all run for office every 2 years. So everybody has a 2-year time horizon. So they're always shooting for the hoop, is what I call it. So they want to get to solution quick so they can go back to their district and say, look what I did for you, whether it did anything or not, or that it's even measurable. So that's something else I bring. And the last thing is, nurses are really great at this. We are scrupulously honest, which is why for the last 20 or more, I guess 30 years now, except for 2001, we are rated the most trusted profession in the country. That is not by accident, and that is not because our turn came up. It's because it's true. And so when I make a mistake, when I take a vote that turns out not to have been such a great vote, this has happened, right? When I come up with, I file a bill and it could be better, and I listen to my constituents, or I listen to whoever can better inform me, and I say, oh, that was very helpful. Just like you, I say, I made a mistake and I learned from it. Nurses are really good at that. Politicians are lousy. The first thing they want to do, they're looking for who to blame, who to throw under the bus. Oh, I wasn't even in the room, they say, right? It wasn't my idea. If it worked, they're there, and if it didn't work, you can't find them. And so I can't stop myself.
Yeah.
And this makes us excellent, not just excellent nurses, because it does. It makes us really good folks in any kind of group, right? But it makes us terrific policymakers at every level of government. And the other thing I'll say that I do, Terry, is I make it a point in every committee I'm in, and I do serve on healthcare in the Senate, and on Health and Human Services Appropriations, but I'm also on Commerce and Insurance, a committee I asked for, state and local government, because I understand it, and of course love that, and the Rules Committee, which is the most powerful committee in both of our chambers. But I have to serve in committees that aren't just about health. Mm-hmm. I don't get a pass, and no elected official gets a pass to say, well, I know a lot about banking or farming or engineering, so I'll just vote on those bills. No, sir. We have to vote on every single bill. And in the Senate, in my state Senate in North Carolina, we get 5 seconds to cast a vote, and that vote is electronic and immediately known by everybody. And it becomes part of our permanent record, almost like you're in school, right? And so I use nursing examples and healthcare examples in committees like transportation, or when we're talking about a transportation bill. And here's an example. So if I've got folks who really know a lot about transportation, but they don't know much about healthcare and nursing in particular, and I come from a state where nurse practitioners are still required to have physician supervision, that's not actually supervision. How many NPs I got in the room here, NPs and school nurses? Okay, so what I just say to you is it's not really supervision. It's a piece of paper that gets signed and a couple of meetings held a year. It's not the Merriam-Webster definition of supervision. So when I'm trying to explain to a lawmaker who understands transportation but doesn't understand healthcare or advanced practice nursing, here's an example I use. I go, you know, this is just like if our state, and I'm making up numbers here, if our state spent $500 million to pave 20 miles of 6-lane highway, and then we said, on the day we cut the ribbon, we said to all the drivers, all the citizens, look at this beautiful 6-lane highway. We just spent, pardon my French, hell of a lot of your tax money on this, but you can drive on 3 lanes, just 3 lanes. But they would raise hell, wouldn't they? Right. But we do it with nursing education all the time in advanced practice nursing in my state. We subsidize our UNC system, and almost every school in our University of North Carolina system has a nursing school and has graduate nursing programs that produce nurse practitioners and other APRNs. And yet we educate them here, and our state says, and here's where you can practice, 3 lanes basically. And suddenly the light bulb goes off and they get it. Why? Because nurses are so good at using the language of our audience, right? That's one of the things that I have found is really important and different when nurses do it. We get to know the person we're talking to. We want to have enough of a working relationship with them to connect with them, to use a language they understand, to translate what we're trying to explain in a language they understand so they can help themselves and help us in the case of policymakers. So, you know, it's been a natural thing for me to do that. I don't even have to think about it.
Well, and it again, I will say, I think you've answered my next question, which is why do you think it's essential that more nurses, especially school nurses, get involved in policy and advocacy? You just described it so beautifully. Would you like me to just go on to the next
No, ma'am, I want to say one more thing.
All right.
So, you know, and that is this. You know, we'd like to think that we're out there doing our jobs great. Like, look at how nursing stepped up to the plate during COVID, right? Did nurses run away? No. Nurses went into it in the middle of the unknown, at the worst possible times when we didn't know if we were going to take that virus home and give it to our family, right? Or going to die from it ourselves. And we would like to think, wouldn't we, that nurses everywhere, especially school nurses, that your work does not go unnoticed, and that when people are sitting around the table who aren't nurses, whether that's your school board or whatever it's called in your state, in your county, or however it works in your state, and they're making decisions about salaries for school nurses or resources for school nurses or whatever would help you do your job better, wouldn't you think that they would go, man, those school nurses are knocking it out. We should ask them what they want to have happen. Hey, better still, let's put a few of them in the room and ask them what they want. Does that happen all the time? I'm guessing not. And so you have to advocate for yourself, because here's what I know. If you are not at the table, you are on the menu. And you will either not be thought of at all, that's bad enough, or you will be thrown under the bus because people go, well, you know, nobody's here to speak for that. And the next thing you know, your salaries are cut or your numbers are cut. They're not filling positions or something like that. Or they're making your job harder to do. Maybe because they add another school or 2 to your caseload. And you know yourself, you just can't. You know, all the high schools in my district have 2,000 students or more. So even one school nurse, I know the standard is now one school nurse in every school at a minimum, right? But even one school nurse in a school with 2,000 students is a spit in the ocean, right? So the point is that you got to tell your story. And you have to tell it not just to other school nurses. I love nurses, you know, I wouldn't be anything else. We're really good at talking to other nurses about this didn't go right, or we ought to do this, but we don't get outside of our little cadre of nurses. We either don't go to, hopefully, a nurse in management and say, you know, after you have some relationship with them and say, I'd like to talk to you about this problem as I see it. But even more than that, sometimes you often have to get out of that nursing altogether. Talk to members of the school board, right? Talk to the chair of the school board, or the members of the school board. And beyond that, to whatever policymaker is making decisions that have an impact on your work and the children that you take care of, children and young people that you take care of. If you don't do it, here's my point, nobody else will. And if they try to, if they're not school nurses, and they try to tell the story of a school nurse, they are not going to tell it the way you would want it told. They're going to tell what they think it's like, right? What they read in a book or what they remember from 35 years ago when they were in school, and that's not good. So we have got to be able to tell that story ourselves, and we have the skills to do it. I think we often think that those advocacy skills, you know, you go to the mat for the children you take care of and your schools that you're in. I know you do, and you don't think anything of it. And yet, we think that we take off it's like a cape, right? Advocacy is like a cape, and you take it off at the end of the day, and when you go to your faith community, or you go to your town council, or you go to, you know, wherever you are where policy is being made, you think, oh, but I can't do that here. And my message to you is, yes, you can. Not only can you, but you really have to, because nobody else is going to do it. And even if they try, they're not going to do it as well. So I'd be happy to give you some more details about that later if you want to hear it.
Thank you.
But you do harder things than this, let me just tell you.
Senator, what would you say to a school nurse who feels unsure or unqualified or suffers from that imposter syndrome to engage in advocacy or civic leadership?
Right. Well, I think we all want something we want the easy button, right, like Staples has. and there actually is some ease to this. There is, so I'm going to tell you about that. If we've never done this before, anything like this, it can seem so daunting. You think, oh, only somebody who's been to whatever the Capitol building is and already knows everybody can do it. That's not true. Has anybody here ever been to lobby day for your organization, either at the federal or state level? Okay, it's a decent amount of people. What I'd say to you is that's like a great first date. But I would say most of you don't get married after one day, right? I mean, you gotta practice. You know, gotta date more people and find out who you want to spend your life with and everything. So lobby day is a great way to get your feet wet and to see what it's all about. And if you've never done it before, I always say buddy with somebody who has. Go watch. You know, it's not exactly see one, do one, teach one, but I'll tell you this. After you see one, you're ready to teach one because it's not that hard. You go in for a scheduled appointment, and here's what you do. You don't go in there with a long list of bills that you want passed. If you've never met them before, no. Would you walk into a room with a student, a sick student, who maybe they have asthma and now they've got upper respiratory infection, now lower respiratory infection on top of their asthma, and their mother's with them, for instance, and you're going to launch into everything that needs to be done in the home to help that child not have these exacerbations of asthma and then get this lower respiratory infection, boom, they're really sick, might even have to go to the hospital. No, you're taking care of the immediate problem first, but before you even do that, you have to get to know that child and mother, right? And you're just walking in saying, hey, I'm Terri, and by the way, you need to do this. That is not going to work. If you've tried it, you know. You go in and you get to know that child. If you don't already know them, you get to know that parent. You find out what's on their mind. You try to form the beginning of a relationship such that trust is built, so that when the child is healthier, more well, and you talk to that mother, you talk to that child, and you talk about the things they could do in their home that could improve the child's asthma, whether that's getting rid of carpet and have, hard flooring, whether that's linoleum or wood, or whether it's just getting rid of some flow rugs, or it's to think about whether the cat sleeps in the bed with the child, right? But you can't ask anybody to do a big favor for you, like vote for this tough bill, if they've never met you before and they don't know who you are. You got to put some money in that bank before you can take any kind of withdrawal. So my advice to you is, if you haven't done a lobby day, do one. There's going to be some other things to talk about. Go in there and get to know the lawmaker. You're only going to get 10 or 15 minutes anyway. And if you go to Congress, if you do a Congressional Hill Day, you may even talk to their staff member that handles health care, not them. Don't be disappointed. These smart young people, they're all like less than 25, they are listening to your issues, and they're going back to either the congressman or woman or the senator, and they're saying, I had the most fascinating conversation with a series of school nurses from your district who came and talked about XYZ, and I think you should do ABC. That's what these young people do. They are advisors on these issues. You want to get to know the person before you ask them, now I want you to take a vote on HR 1073, or in my case, Senate Bill 696. Because when I know you, and I've seen you more than one time, and then you call me up and say, hey, Senator Adcock, this is a really good bill for school nurses. I know there's some controversy about it, but it's a really good bill. Or Senator Adcock, we need you to change this. Would you run an amendment on this bill, because it's going to hurt school children who need care at school by school nurses. I am much more inclined to listen to you if I'm in a big hurry or I got 6 other people want to talk to me that morning in the next 20 minutes. I am more inclined to listen to you because you come from a place of trust, relationship, and of course our connection as a nurse. So I would say that's what so many of us don't do. We want to send that quick email. I totally get it. I get 200 of them a day, or sometimes an hour. And people will say to me, hey, did you get 200 emails today? And I go, no, I got the same email 200 times. Don't do this. I bet you're getting email alerts from any kind of group that you're signed up with, right? Advocacy groups, whether it's school nursing or the environment or whatever. Well-meaning people. And a great thing to do if you do this. You take that long email, they're usually very long, very complicated, and you personalize it. So you change the subject line to something that's not the same subject line they sent you. If I get 200 emails and they're all labeled, like the latest one is, close the kill shelters. Okay, I get it, but I've read one, I've read all 200 now. So I need to, my LA legislative assistant will make sure they live in my district, but I'm not reading every single one and they're not personal to me. But when somebody writes to me and says, Dear Senator Adcock, I live in your district, I am a school nurse who lives in your district, I am in these schools, and you name the 2 or 3 schools you're in, and I'm very concerned about children coming to school hungry and the funds that are going to be cut at the federal level. And I would just, I'd love to talk to you about this and be a resource for you. And you signed your name, you put your home address, not your work address, because that's not where you vote from. Put your home address, so they go, oh, Cornelius. I know people in Cornelius, maybe I live in Cornelius, right, North Carolina. Personalize, take the guts of that message, pull out 2 or 3 things, personalize it with your story, sign your name, thank them for their service. You may not think they are doing everything right, they still represent you. And I will say that even though you may not always agree with the vote or the position that your elected leaders are taking, it is nonetheless hard work. Nobody goes in, I will say this for legislatures and the legislators I know across the country, I don't think anybody goes into that job every day with the intent to hurt people and do bad. Maybe the policies that they come out with will hurt some people because they didn't ask the question, who does it help and who does it hurt? And how much, and is it worth it? But you need to have, if you start your message off with, Dear Senator Adcock, thank you for your service. My name is Terri, I'm a school nurse in your district, and I take care of children with this problem. I am going to remember you, and I am going to listen to you, particularly by the 3rd time Terri comes to me. I'm going to go, hey, Terri, boy, you really are like a dog on a bone about asthma in children. And that's good. You want to be sticky, right? So those are some ideas, and then here's the other thing. The people who represent you, who are the closest to you, so your local government leaders, your city and town councils, county commissioners, school board members, and of course your legislators, that's public information. If you don't know who these people are, it is easy to find. Number one, you look on your voter registration card. It will give you the district numbers for all of those levels of government. And then you can Google it, like who represents District 6 in the House in Iowa. Boom, it'll pop up. You can go to the website for your legislature, since I know the most about legislatures, and that homepage is a wealth of information. In our state, You can find, everything. You can find the list of the House and Senate members. You can click on our names. You can go to our personal webpage. You can see what we look like, so you recognize us in the halls or recognize us at an event or recognize us when you come into our office. It tells you what my career background is, so you know if the person you're going to see is a farmer or an insurance agent or an engineer, and you're already thinking of the language you might want to use, right? It tells you how many terms they've had in their particular chamber and if they've served any time in the other chamber. And it'll tell you every bill they've filed and every vote they've taken. So you can look at the bills. You pull up my bills, you'll see a lot of healthcare bills, but you'll also see a lot of bills that are what I call tangential to healthcare, but are health related. And then you can look and see, so that'll tell you a lot about the person. If it's all transportation bills or all economic development bills or all education bills, then you know if you're going to talk about healthcare, you're going to need to couch it in language that this person who doesn't serve on the health committee and doesn't have a lot of background in health can understand. People who have their big focus is education, they really connect with school nurses because they want those children able to learn, and you can't learn if you're, very ill. Get to know them, send them an email, just as I described, go to a meet and greet that doesn't cost you any money, or go to a small fundraiser, talking, penny ante, $25, $50, it's not a huge ticket to get in. Meet them in person, go to their town halls, those are free, and become a known quantity. You don't have to know everything, but if you are recognizable on sight and name with your elected officials, then when you do need something, that is when that will all pay off.
Wonderful, thank you. Can you describe a time when a nurse's voice or your own directly impacted legislation or policy?
Yes, right before COVID, so interesting, I don't know if y'all noticed this, but when our state was dealing with telehealth, we were talking about telehealth. They were calling it telemedicine, and I'm going to tell you in a minute why that makes the hair go up on the back of my neck. But we were, the conversation in our health committee was, I was in the House at the time, was we can't do this because all of these roadblocks, and these were from the commercial insurers and people like that, and then the non-healthcare people who didn't understand the need for it. Okay, COVID hits, and what happens? Boom! Everybody's doing telehealth overnight, right? Because you had to. We were in our practice. And of course, you guys weren't even able to go to school. Some of you were bound to be from states where they closed the schools. We were doing all virtual school in North Carolina for quite a while. Well, being a nurse practitioner for 38 years, at that time I guess it was like 34, what I knew was this: if you label something that many different providers are going to use, and this is technology, this is not there was talk at one time about even having get this, telehealth license. So you would have to have a special license to simply provide your same services using a virtual platform. That's nuts. And not to mention expensive and extra regulatory burden and all this other jazz. We had to kill that idea. I helped do that. But as we were having these conversations, as it got real, from the very beginning, I kept raising my hand in the health committee saying, let's consider that it's not going to just be physicians who provide health care, appropriate levels of health care using technology, right? It's going to be nurses and nutritionists and nurse practitioners and physician assistants, and all kinds of folks are going to do it. So we can't call it telemedicine because nursing is not medicine. Physical therapy is not medicine. Nutrition is not medicine. And what I know as a nurse practitioner in a state where we are required to have physician supervision in the law is if we called it telemedicine, at some point the issue is going to come up of, well, yes, you can do this if some physician somewhere has signed a piece of paper that you can do it. No. So I started raising my hand every time going, we really, and I just kept beating that drum till finally I think they just got sick and tired of hearing me. And they changed it I changed the language from telemedicine, which I knew was going to be problematic to nurse practitioners like me and everybody else who was going to need to do this, to telehealth, and that is what is codified in our law, is telehealth. Seems like a little thing, But it is not a little thing.
Language
And-
matters.
Language is extremely important. Yeah.
Yeah, I love that. Thank you. What are some practical first steps a school nurse can take tomorrow? I'm challenging you all to do it tomorrow to become a more active advocate.
So let's start with your own house. If you don't know who the members of your school board are, go online, Google whatever the name is. So some of you probably come from cities that have your own school boards. I think they do that in New Jersey, right? In North Carolina, it's all county-based. So however it works in your state, Google members of the fill-in-the-blank school board, read about them. And most school boards are made up of districts, so you probably live in a district that has a dedicated school board member. I would suggest you get to know that person. I've already told you how to do it. You send them an email and you say, hi, I am a school nurse in your district. I have these particular schools. This is my specialty or whatever. And I just wanted to say thank you for your service. And I would like to be a resource for you about issues for children who attend school. Okay? Easy. Give them your name, totally, and your home address, and of course, they got your email because that's how you send it, and whatever number you want them to reach you by. And I will tell you that when I get these, and I don't know that everybody does, but I certainly do, I forward it. First of all, I answer every email. Either I or my LA answers every email. It depends on what the issue is. But I forward that message to my LA and I say, Bella, please add this to my contacts and tag it as a school nurse in this county for these schools, or my county in these schools. So that when an issue comes up and I don't know the answer, or I just want some backup, right? Because I haven't been a school nurse in, like I said, 40 years. So I want a current school nurse backing me up, or if I need to get out a lot of school nurses down there to talk about a bill, or maybe 20 school nurses to email the head of the health committee to say, hey, this bill is good, push it, or hey, this bill's not good, send it back. That's who I'm going to reach out to. So that's one way to do it. And if you have the chance and the opportunity, and you don't have to do this by yourself actually, it's nice with 2 or 3 other school nurses, invite your school board member out for a cup of coffee. I can tell you that I do a lot of coffee meetings with constituents, and I do several a week, and I don't do them, my favorite place to do them is not in the General Assembly building, where folks have to drive through the traffic, find a place to park, good luck to them, navigate the confusing building, find my office, and maybe, if they're lucky, get 15 minutes. But they've invested a heck of a lot of time to get down there. I'll get interrupted, I might have to go to caucus early, somebody, a lobbyist may come in about a critical bill, vote that's coming up that afternoon or something like that. But if you make an appointment with me to meet at Starbucks, because there's a gazillion of them in my district, then you're going to get more time with me. You're going to get maybe 30 minutes. If you bring 2 or 3 people, then it doesn't, the heat's not quite on you so much because you can spread it. And then each of you can say, here's the schools I work in, and things like that. And it is not the least bit scary. Your school board member will most likely be gratified to do this for you because they want to know what's going on in the schools. And they're not working in the schools, and yet they're making policy for schools. Some were former teachers, or maybe even current teachers, depending on what y'all's rules are. And you may have children in the public schools as well as be a school nurse. You're coming at this with such a rich background, but consider doing those things. And I would throw one more thing in. In our county and across our state, our school board meetings are either live streamed or they're televised. If you've never watched a school board meeting, you should do it. You should see how, and particularly before you meet your school board member, you want to see how they are conducting themselves at the table. What are they talking about? What seems top of mind to them? What are their remarks like? You're doing a little homework on them. Just like, when I worked in a hospital and in family practice, I'd always look at the chart for my patient before I walked into the room so I didn't go in there cold. Well, that's a little bit of research on there that you can do. And if you want to, you can also go in person. And I'm going to tell you it depends on the issue, I guess, but not every one of these governmental meetings are well attended unless there's something really hot on the agenda. But if you go to 2 or 3 of these in 6 months, people are going to start paying attention. Who is this nice lady that always sits in the front row or the back row, and there's 2 or 3 of them? Or maybe you even wear a button or a placard that says, I'm a proud school nurse. so they recognize you. I'm not talking about carrying a sign now. I'm just tagging yourself. Yeah, that makes people nervous. I used to say when I'd go into town council meetings, I think it's going to be a good night. I don't see anybody wearing the same color shirt, large numbers of them in the back with a big placard, right? Because that meant it was going to be a rough night.
Senator,
so does that help?
It does, thank you. You've shown that advocacy can take many forms, not just running for office. So how can nurses find the advocacy path that fits them best?
Well, this is a great question as well, because not everybody's cut out to run for office, not because you don't have the ability, but it just doesn't float your boat, right? It's just something you're just not interested in doing. That's fine. I do wish more nurses would run for office. You know, there are only like 76 nurse legislators out of 7,100 in the country. 7,100 legislators, 76 nurses. That's not good math, right? We want to change that. And I don't know what the numbers are in local governments and everything, but there is a great opportunity for nurses of all kinds, and school nurses as well, to be appointed to boards and commissions that are advisory to your town or city council, your county governments, your school board, your state government, and of course at the federal level. You can find these by going to your county, I'll use this example because this is the one I'd probably know the best. So you live in a city or town, so you go to their homepage, you go to their website, and you either use the search engine or you can use a drop down, usually if you look for council or governance or something, but otherwise you can put in the search engine boards and commissions. And you may have to spend 5 or 10 minutes looking around, but you will find it, and they will list their advisory boards and commissions. Like in Cary, we have Public Art Advisory Board, Historical Structures. We have a commission on seniors because we have a growing senior population. We've got the economic development, and of course the biggie, the Planning and Zoning Board. Every municipality in our state anyway is statutorily required to have a planning group to make decisions about land use. That may not sound sexy to you, but I'm going to tell you what, this is the most powerful board in every municipality. Because when people decide what's going to happen with land, how many houses per acre, whether it's going to be low, medium, or high density residential, high density meaning apartments, medium density usually meaning like townhomes or condos, and you know what single family homes are, whether it's going to be zoned for special use or whether it's going to be zoned for office and industrial or whatever, that depends on where people are going to live in your town, and is it going to be close enough to schools that you'll get schools that are representative of the community versus are segregated, not because segregated more because of zoning, restrictive zoning laws. I mean, there's all kinds of things to look at. But look at those boards and commissions. You can read about them, you can click on them, you can see what's their mission, what's the term. In our state, in all the municipalities, it's 3 years. When are the terms up? Who's serving? You can see, all of this is a public record because government was set up to be transparent, right? So you can see who's already on the board. You may know people who are on these boards that you didn't even realize they were. So not only can you ask to be appointed, because there's a application process and a vetting process and everything, it'll tell you what the time cycle is for that there. But if I always say the next best thing to being the policymaker is, well, it's actually equally as good, is influencing the policymaker. And so if you realize that someone you go to church with or in the Rotary Club with or your kids play soccer with, and they're on a board or commission for your town about an issue you're interested in, you can talk to them. And you can say, can I talk to you about this thing that's on your agenda, this park project, and whether there's actually going to be a park on this side of town where there are no amenities like that, and yet we continue to have new families move in and their children need some place to play and there isn't anywhere. I mean, talking to them and putting a face on problems, nurses are really good at this. Mm-hmm. So those are some excellent ways to become a known quantity, to use your knowledge and ability, and to have an advisory role with people who aren't nurses. And if you're sitting there thinking, well, what does the nurse know about public art or about economic development or planning and zoning? Let me tell you, these groups are looking for folks who are not experts in these areas. Right. We don't need another land planner and another engineer and another architect on planning and zoning. No, we need normal people. I mean, we need everyday people who go, wait a minute, why do we want to put more density near our water supply? I mean, people are asking questions like this. Or how are people who live in this apartment complex there's not enough roadway to get them in and out safely. I had to ask this question one night, how is a fire truck or EMS going to get in and out of that cul-de-sac when it is not, and we stopped doing cul-de-sacs for that very reason, because you can't get emergency vehicles in and out of there safely. There's not enough turning radius. I mean, we need folks who are looking at problems in a very broad, holistic way. Nurses are really good at that. Again, health in all policies.
As we wrap up, I hope this conversation with Senator Gale Adcock has given you new ways to think about your own path to advocacy. She reminded us that while not every nurse may run for office, there are countless opportunities to bring your expertise to the table. From serving on local boards and commissions, to advising policymakers, to simply asking the right questions that shape healthier, stronger communities. Nurses see the big picture, and our voices are essential in every space where decisions are being made. Thanks for joining us for this episode of Beyond Bandaids. You can find this podcast on Apple, Spotify, or on the NASN website. Don't forget to subscribe so you don't miss an episode. Until next time, let's keep ensuring that students are safe, healthy, and ready to learn.